Welcome back to Imperial College, and with me is Mr. Chukwuwmeka, who, as well as being the medical director for this branch of the hospital, is also a cardiac surgeon. A cardiac surgeon not doing any cardiac surgery at the moment. So that's part of the Pan London plan. So, Andy, what is the plan?
The plan, I think, is a real tribute to the ability of this system to focus on the problem in hand. So we realised what was about to happen, and at an early stage it was agreed that the cardiac surgical work in London would focus just on two units, geographically separate, so you had equity of access for patients across the whole of London. But those units would focus on doing not just the very, very few elective cases which would be done, but the urgent and emergency cases as well. We had to devise a system where surgeons could travel to these different units, and we had to make sure there were rotas in place to support these units, recognising that doctors are just as likely to get ill, perhaps more likely to get ill than as patients. So cases are still being done, but only on the basis of absolute clinical need. There is a recognition clearly in cardiac surgery that cardiac surgery is a heavy user of intensive care resources, which one are likely to be scarce, but secondly, patients going into intensive care in the environment that we predicted would likely not have a good outcome. So that if there's any means of temporizing or finding alternative treatments, for example, TAVI as opposed to aortic valve replacement, we would recommend that option rather than putting patients through what by default is going to be very high risk surgery, not because of the nature of the surgery, but the nature of the recovery in a COVID-rich environment.
Okay, and I think that we have seen that across the patch that what ordinarily would have been referred for coronary bypass surgery, if we can do it with stenting, we are. And again, 65-year-olds, very low risk for cardiac surgery for aortic valve replacement. A TAVI is now a realistic possibility, and of course, they will do very well in the short term. We will have to track these patients in the longer term to see exactly what's going to happen.
Indeed. Yeah.
Thank you.